I made a post earlier concerning a woman who becomes blind or visually impaired following delivery. If you know what developing high blood pressure does during your pregnancy, you understand why whenever you come for your antenatal clinic and the nurse notifies the doctor that your blood pressure is high, and the next thing we'll start asking them, please run a urine analysis on this lady, and then it comes out 1+ of protein, 2+ of protein, and your blood pressure is going up. Sometimes it may be as early as you are 18 weeks of pregnancy, you are just about 3 months. Sometimes it may be just about 5 months. Some people even begin to develop that thing at 8 months. Some even in labor. We now observe that the BP is rising, and then they do a urine analysis and it's showing 1+, 2+ of protein. We are bothered. In fact, if your urine analysis begins to show protein 1+, 2+, it is telling us that there are actually small damages to your kidney. And normally, protein not supposed to come out from your kidney. If kidney be like saying a mosquito net, you get, it will sieve out the thing where you see as pee, sabi urine, fine. But when that mosquito net gets bigger, mosquitoes pass through that net, you get. So when that thing gets damaged, what we call the endothelium of the kidneys and all that, proteins will now begin to pass through. Protein big pass glucose. So even if you get diabetes, we see glucose for urine, we'll not go too bother. We say, okay, this woman get sugar problem or diabetes problem, you get. But for us to see protein in your urine, it means your kidney is actually having some slight damages. If you know the little damages here and there that preeclampsia does to the human body, you would understand why we are so concerned. We'll give you that injection that when you take it, you feel hot inside, what we call magnesium sulfate injection. We want to protect the baby's neurological system, the baby's system generally. And we will now start giving you maybe medication, depending on if your baby is not mature. We want to get your baby mature. We want to, as much as and as fast as we can, stop that pregnancy. Do you know what it does? Your BP begins to shoot. It starts damaging your kidneys. It goes to your eyes. It starts damaging the small vessels in your eyes. And then you now see that this woman begins to develop blurred vision. She said, doctor, I can't see clearly. Before you know it, she's blind, what we call amaurosis fugax. And then from there, you see her, she may even start developing convulsions. The small barriers in the brain break up. These are inflammation in every part of the body. That is how bad. In fact, preeclampsia, if it is not managed on time and that pregnancy is not stopped, depending on some conditions too, you understand? If that pregnancy is not stopped, depending on some conditions, and that problem is not managed, it gets to a point where you begin to get what we call DIC. DIC is, they give you a cut here. No, it doesn't stop. The woman continues to bleed uncontrollable. At that point, we are even scared of taking that woman to theater. We don't want to put a knife on her. We even wish she just delivers on her own, and we now find a way around. We start scouting for fresh whole blood. We start scouting for platelet concentrate. See, if you know how important antenatal care in a center that knows what they are doing can help your life, you will take every pregnancy serious. And that is why you need to plan your pregnancies so that you can be financially capable to take care of yourself during pregnancy, labor, and delivery. You know, a small thing like this, life don't go. And see, at the end of the day, everybody got adjust. So my dear pregnant woman, take care of yourself. Before you plan that pregnancy again, be sure you can be able to cater for yourself if there is situationship. I tell you, your own may go smoothly, thank God. But if you see women who have gone through a whole lot, some who have had paralysis of this whole place just following pregnancy. I know of one who has been on wheelchair since her last delivery. And then tomorrow a person will ask you, what do I bring to the table? Of course I bring value to the table, you know. Have a lovely weekend. See, I'm not sure. I say yesterday, person go call me, emergency call me, I can't attend the emergency. That's how our life be. I love you.